A case of careless digital housekeeping has turned into a distressing, disturbing, horrifying cyber scandal and an agonizing horror for patients at a maternity care hospital in Gujarat's Rajkot. The hospital's digital housekeeping lapse helped hackers gain access of CCTV systems in that maternity ward and in that hospital. What followed was nothing short of a nightmare. Hackers accessed intimate footage of women who were being examined in the maternity ward. The data was sold to the international market of porn for profit. What makes this breach even more bizarre is that this reportedly continued for over a year until the perpetrators were finally arrested earlier this year in February. Now reports are suggesting that the hackers had in fact gained access to at least 50,000 such clips over 9 months from across the country. It wasn't just limited to one specific region. It was spanning across at least 20 states in India. Investigators found around 80 CCTV dashboards which were compromised nationwide, and it included Delhi, Pune, Mumbai, Nashik, Surat, Ahmedabad. The main accused was identified as Parit Dhamelia, who is a BCom graduate, and second accused was identified as Rohit Sisodia. According to the data by the Government of India, there has been a major surge in cyber fraud cases in India. Cases rose from 10.29 lakh in 2022 to 22.68 lakh in 2024. And cyber frauds amounting to rupees 36.45 lakhs reported on the National Cyber Crime Reporting Portal as of 28th of February 2025. In the 2025 Union Budget, central government had allocated 782 crore rupees for cyber security projects. A helpline number has also been issued by the government to provide assistance to people in cyber fraud related cases. However, the recent spike in cyber crimes has raised concerns among the public about the adequacy of existing laws. Are they stringent enough? Is the execution the problem? Are the laws not commensurate? What is the actual issue? All right, joining me to discuss this further with a point and a counterpoint, I'm now being joined by Ms. N.S. Napinai, Senior Advocate at the Supreme Court of India and founder Cyber Sathi, and Ms. Mrunalini Deshmukh, Advocate at the Bombay High Court. Thanks to both advocates for joining me here on the broadcast. Thank you so much. Ms. Deshmukh, let me start with you first. Ma'am, how are hackers emboldened enough to even attempt, I'm speaking about the recent case that we started this report with, to even attempt something as ghastly, as horrifying as stealing intimate footage? Is there no fear of the consequences? Is a lack of laws in India the problem, or is the execution of these laws, is the punitive action not commensurate to a crime of this scale? Why is there no scare? Your thoughts?
First of all, let's find out whether these hackers have done it on their own, or they have done it in cahoots with the hospital administration. And obviously, this could be the logical way of looking at it. Okay, because I think, number one, and number two, are they not afraid of what is going to be possibly the consequences, which are punitive in nature, surely, and which could have a long-lasting effect? Yes, they are quite sure about it, but at the same time, the quick buck that they can make after selling this, like in the present case, when they have put it on the spawn sites and obviously made, whatever the X number of amounts that they have made, is something which is more of a temptation for them to go into it. But I'm on a larger question, and that larger question, according to me, is that are there enough laws? Probably yes. Is there implementation of these or execution of these laws in a proper manner? May or may not be in that sense, the way they have to be, the firmly that they have to be dealt with. And thirdly, and more importantly, what about the moral fiber of the people when they stoop to such levels where they are exposing women who have gone with a genuine medical issues to a hospital, either during labor or during examination or any of these things which are there? So why is this moral fiber going to this kind of a level? And the perversity that is prevalent in the society And of course, hackers are a part of that society.
I hear your
And
point.
last, more importantly, is converting it into a pawn. I mean, we have to look at it from all these points of view.
I hear your
So
point.
I think to answer your question, and without taking much of your time, to answer your question, that it has to be dealt with absolutely an iron fist, and that iron fist has to be deterrent in nature. But what is that thing that could be deterrent
Understood.
is something that my colleague here, who has a lot of experience, and
Yeah,
I've also
let me come in there, Ms. Deshmukh.
in that she will be
The
able to tell better on that.
Yeah, this Ms. Deshmukh, as you mentioned, the iron fist and the deterrent. That scare, is it there, and why is it not there? Clearly, because they've gone on, and facts also suggest that those clips were still being sold months after those arrests were even made. Ms. Napinai, let me come to you with the same question. Do you feel these laws are commensurate? Is the punitive action not commensurate? Is the execution the problem?
I would say, there is no such thing as only either or, right? So, Mrinalini has nicely put out all the issues that we have today. What it really goes down to is two things. One, as she said, there is no moral fiber with the people who are committing this crime, but the hospital also needs to answer to how is their technology in a place that's meant to be private? Why is there a CCTV or a recording mechanism which can be hacked and misused by the hackers? Why is it even there in an examination space? That's a private space between the doctor and the patient. The hospital should not even have equipment there which can be misused in the first place. Secondly, the question that you have posed, which is very critical, we have laws today which can be applied to a situation like this. It's not like we are living in a legal vacuum and therefore the criminals are getting away. It's pure and simple the fact that one, implementation or execution of these laws have been very weak. You do not have sufficient examples set or illustrations set to deter criminals from committing these crimes.
Ms. Napinai, allow me to come in there. I take your point there that there is not enough deterrence, any kind of an example which needs to be set for the criminals. Somewhere behind the mind, that thought is clear that they can get away with it. And they can clearly, that is the reason that cybercrime is definitely doubling from 2022 to 2024, the figures that we had, and only increase thereafter. Let me quote a very, very simple example. Something not of this scale, which we discussed in this report, but something which happened very close within my own house. Somebody's number got hacked. After getting hacked, a cybercrime was, the complaint was filed, and the cop called back and said that, listen, you've told me the numbers from which your phone got hacked, but these numbers cannot be traced. There is nothing that can be done. You can continue with the complaints, but I'm telling you clearly nothing is going to be done. So if there, do you find this a problem of the laws which are there in place? Is there not in, how can an example even be set when the authorities themselves are clearly have their hands up saying nothing is going to be possible?
Exactly.
Ms. Napinai, let's start.
Yeah. So absolutely right. So, having more laws doesn't really help us when even the laws that we have in hand are not being put to good use. So today what you need is, and each regulator has to take responsibility and start coming out with solutions. Putting their hands up is not a luxury that is there with a regulator or law enforcement.
Ms.
So
Deshmukh,
what we need
Ms. Deshmukh, let me just quickly come to you regarding the case that we just discussed.
Let me complete the sentence.
Okay, please.
Let me just complete my sentence. Don't stop midway. So it's critical that one, we have laws that are clearer, yes. Two, they are better implemented so that they set an example. And three, most importantly, victims need remedies. They neither care about what laws there are or there aren't, but they really want to see it in action. They want to see that the system works for them. My humble request to victims is make the system work for you. Don't shy away from it. Thank you.
Ms. Deshmukh, is there any way that the victims can really make this work in their favor, especially when there is no scare in the perpetrators from carrying out? Because this wasn't an isolated event in one maternity ward. It happened across 20 states across the country.
I think I would go the only way that could be some kind of equity, and I'm saying this with a little bit of hesitancy also, to be very honest, is that these victims have to be compensated by these hackers. You just cannot penalize them, and you just cannot let them get away scot-free. And even if they get, there has to be some kind of compensation which has to be given to the victim. Now today, the point here is that the system will take its own time. The system will obviously they have appeal. I mean, that's the way our legal system is, and there will be ways and means of doing it. In the meantime, it is the innocent women who were patients for lack of a better word, who had gone to the hospitals with an intent of getting them treated or getting whatever they had gone for, were exposed to this kind of a horrific situation. As Ms. Nambiar has rightly stated, that why were the CCTV cameras in the first place in the examination room or the labor room, as the case may have been? Was it done by the hospital authorities only to ensure that there is no doctor's negligence? Is that the concern? Or was it done from the safety or the security part of it, is point number 2. And why are we not holding the hospital authorities responsible for this? It is their duty to ensure. The buck stops with them, and I'm not letting the hackers get away with their murder. I'm not trying to say that that they should not be treated. But ultimately, we have to ensure, as an authority or as an institution that we are in, that all these measures are taken. So I think the hospital also needs to let us know why were there, as she very rightly put it, Ms. Nambiar, that why were there CCTV cameras in these rooms which are otherwise very private, and where it's an examination of a lady's body that is going on, or the labor that she's undergoing, which is there. So my suggestion is that the hospital needs to have a thorough investigation of its own system. The police needs to register a case with them. The victims can ask for compensation from the hospital authorities, and obviously the hackers who are there will be treated as per the law. And whether it serves as a deterrent or not, I really do not know. And I said, this is just the mindset, this is the moral fiber. Unless we bring about this change, people are going to have some kind of...
Ms. Deshmukh, allow me to come in there very quickly. We'll take one more reaction from both advocates. Ma'am, as of now, within the legal framework that we have, for a layperson, for a crime like this that we just discussed, what is the punitive action that these perpetrators are currently, or what they would be facing?
First and foremost, under the Information Technology Act, you already have a provision under 66E, which says that if a person's private parts are recorded without their consent, that's a separate crime in itself. And the second part, where it is published or transmitted without their consent, by itself, that's an offense. So here, the hospital authorities will also have to answer to, did they even take the consent of the patients for this kind of a recording in the first place? Right. Leave alone the kind of violation that happened thereafter, right? The second aspect of it is, you again in the Information Technology Act, sharing of obscene or sexually explicit content is an offense under 67. You have various provisions under the Bharatiya Nyaya Sanhita too, including in terms of dissemination of pornographic content, which is violation. Similarly, the equivalent of that is what I already mentioned, Section 67 under the IT Act. Now, where we really need to delve even deeper is when it comes to victim rights and what is it that they can get. So Mrinalini spoke about compensation. Now, what are the provisions that help them in that?
Yes.
They will have to necessarily seek their remedies in two fronts. One is, any victim can seek for immediate removal of this content from online sites without having to run to police or court. And that's what the intermediary guidelines of 2021 provides for them, that you can approach a grievance officer of a platform and ask them to take it down. Understood. Now, dark web sites or pornographic sites may not do it.
Yes.
Then you can approach MeitY. It has a government committee as an appellate committee, and they can then seek for blocking of this content. As a last resort, you can go to the police for blocking of the content, but you will have to file a civil proceeding for you to recover damages from the hospitals.
So, Ms. Napinai, as I understand from your response, that the provisions are there, but then the execution needs to be enough to set that deterrent or set that example, because clearly the deterrent the deterrence doesn't seem to be enough because cybercrime only seems to be increasing. We leave it there for now. Thank you so much for both advocates for joining me. Ms. Napinai joining me from Mumbai and from Delhi, and Ms. Deshmukh joining me from Mumbai.